We're now going to discuss some specific gastrointestinal problems, working our way through the GI tract. First started with oral cavity. Fluorosis, it's too much fluoride will stain your teeth. Too little fluoride impedes proper development. Too much fluoride will stain the teeth. Also, teeth can be discolored from tetracycline. There's a very common presentation on exams, okay? So be very careful. You do not want to give any child under 7 or 8 years of age tetracycline, and certainly you don't want to use tetracycline during pregnancy because that can also lead to staining of the teeth. There is an exception for the tetracycline in the age, and we'll mention that in infectious diseases. But overall, remember, if they ask you about giving tetracycline to someone under 7, 8 years of age, try to find a viable alternative for that antibiotic. There are a variety of reasons for teeth to erupt late. Sometimes actually teeth erupt early. For example, you can have neonatal teeth. A child can be born with a tooth, and typically it's kind of loose and you take it out so they don't, it doesn't fall out and they choke on it. But there are a variety of reasons for delayed eruption of teeth, including hypopituitarism, hypothyroidism, trisomy 21, and rickets. Patients, like I said, can be born with some teeth. Typically, most babies don't have teeth when they're born. Teeth start erupting at around 6 to 7 months of age. The first teeth to erupt are going to be the lower central incisors, followed by the upper central incisors, and then the lateral upper incisors, and then the lateral lower incisors. Usually by 1 year of age, most children have about 6 to 8 teeth. By 2 years of age, they have twice as many, and by 3 years of age, they will have all their primary teeth, all 20 of them. Another particular concern is cavities, and there's a variety of causes for caries. Certainly using the bottle after 1 year of age or propping the bottle on the with the child and letting him fall asleep with it can lead to cavities, what they call milk bottle caries. And you can have really bad decay of the teeth from this. Cavities are usually caused by bacteria such as strep mutans, also caused by carbohydrates because carbohydrates provide the substrate for the strep mutans to grow, and there's certainly some patients that have genetic predispositions to developing cavities. So you want to avoid these things, and the milk bottle helps the starch, the carbohydrate in the milk or the juice, pool behind the teeth, and it promotes tooth decay. Also, sticky sweets that stay on the surface also promote tooth decay. It is recommended that you start brushing teeth as soon as the teeth erupt, and you can actually just take a washcloth and rub that tooth and clean it that way. Some of the problems that are associated with teething include tenderness or swelling at the site of eruption. You can also have what's known as an eruption cyst or hematoma. Many babies will have grabbing of their ears because they will have referred pain as the tooth is coming up. The pain is referred towards the ears, and it can fool you into thinking that it's an otitis media. There is no solid medical evidence that teething causes fevers or diarrhea or rashes. That's just grandma talking. Here is a patient with staining of the teeth from tetracycline. You can see those bands right there, and also on the lower teeth, that's staining, so you want to avoid that. Cleft lip and palate. Some babies will be born with cleft lip and or palate, and these do present some distinct complications and problems. Specifically cleft palate more so than cleft lip. Cleft lip is more of a cosmetic concern. Cleft palate, however, can cause feeding problems. They can lead to aspiration, and because of the cleft palate, you can also have reflux of formula and mouth contents into the eustachian tubes, and patients with cleft palates are at much higher risk for otitis media and recurrent otitis media. They are also at higher risk for hearing and subsequent speech problems. As mentioned earlier, any patient has delayed speech, you should always think of hearing problems, and a hearing screen would be warranted. The treatment of cleft lip, again, is purely cosmetic, and you can wait for a little while before you close it. And typically we talk about the rule of tens. So we wait for the patient to be at least 10 weeks, at least 10 pounds and a hemoglobin of at least 10 before surgical repair. Cleft palate can wait a little bit longer for repair. Typically you do it at around 1 year of age. You don't want to wait too long because you can have problems with those complications such as hearing problems and speech and recurrent otitis media. You do get better cosmetic results if you do it at around 1 year of age. Here's a patient with bilateral cleft lip and most likely cleft palate if you were to look at the roof of the mouth. There's a patient that has bilateral cleft lip, this side, and also has, you can see all the way up, this is a cleft palate.